We know that health concerns are the #1 reason why people quit smoking. Most people will say that they understand that smoking is bad for you, but they don't understand the true impact. Hearing stories from former smokers about the ways that tobacco has negatively affected their lives can help motivate them to quit.
We started the Media Capacity Building Project because we saw an opportunity to work with local public health units to help them use the media to stimulate quit attempts in their own communities. Alongside policy and program approaches, the use of the media is one of the key interventions that we have in tobacco control. Published evidence has shown that testimonial-based campaigns featuring hard-hitting messages about the health consequences of smoking can increase the rate of quit attempts. This evidence comes from national and statewide campaigns. What is lacking, however, in the evidence base is the role of local media strategies.
6 projects were selected to participate in the Media Capacity Building Project, and the Program Training and Consultation Center provided training, consultation, knowledge exchange opportunities, and a small amount of funding, which the health units matched through in-kind contributions.
Looking back, this project really took shape when we conducted a survey of public health units in 2015 of their media use. We found that while public health units have media-related capacity, very few were planning tobacco-related campaigns. In 2016, we held a 2-day knowledge exchange forum focused on the topic of use of media to increase quit attempts. One of our key learnings from both the survey and the forum was that public health units would need additional support to take action in this important area.
In July 2016, we put a call out to all the public health units across the province to participate in the project, and 6 were selected by a committee.
The Media Project kicked off with an in-person workshop in Toronto in November of 2016. As part of the training, we provided skill building in the areas of campaign planning, message development, and testimonial recruitment.
The Program Training and Consultation Center developed a number of resources to support the public health units to create and implement their campaigns, including media toolkits, a testimonial interview guide, how-to documents on topics such as recruiting testimonials, ad development, and evaluation. All of the resources that were developed for the project were later made available to all health units across the province.
We also supported the project by creating a working group so that participants could provide campaign updates, share challenges they'd encountered, and discuss lessons learned. As part of these meetings, we also provided additional training opportunities, which included a webinar-based training series.
Through each stage of the project, we provided hands-on consultation support to each of the project participants. This support came in the form of providing advice and feedback on their campaign plans, on any of the draft materials that they created, and to connecting them to information and resources that they needed to move their projects forward.
The Documentations of Practice project captures local public health units' innovative tobacco control practices. We document health units' experiences with developing and implementing initiatives like the media campaigns using interviews and document reviews. And we share the lessons learned through conferences, webinars, and reports so that other public health professionals can learn how to adopt similar initiatives in their own communities.
In a lot of instances, public health campaigns have focused more on the how to quit message as opposed to the why to quit message. With media campaigns featuring testimonials from former smokers talking about the negative health consequences of smoking, it really is that why to quit message, and this has been a real shift in thinking for a lot of public health folks.